Good morning and welcome to the Becker CEO CFO virtual event. We're so excited to have you join us for today's featured session, Driving Value Through Pharmacy, Best Practices for a System-Level Approach. I'm Mackenzie Bean with Becker's Hospital Review.
Very good, Mackenzie. Thank you very much. As you can see, we have three highly qualified presenters today. The objectives are pretty clear. We want to have you get a good background on the Christus and multi-care pharmacy programs and program outcomes as they've worked through transformation work over the past several years. Then Phil Brumman will describe the evolving landscape in pharmacy, which is changing rapidly. And finally, we want to engage all of you and the panel in a discussion of current issues as we look at evolution over the next several years. You will meet the panel just shortly, and they will give a little more color commentary on their backgrounds and their organizations. The agenda for today is really pretty clear and straightforward. We want to hear from Dave Benner at Christus, and he will describe the Christus pharmacy transformation. Then Tim will describe the transformation underway at Multicare, and Phil will give a national perspective on what he sees. I might also mention that Phil Brumman is the immediate past Chief Pharmacy Officer for Frederick Health and the Medical College of Wisconsin. So he brings not only hands-on experience, but now an experience from a national perspective. And then Steve will lead us in a panel discussion talking about a variety of issues. Dave Benner, welcome. Great to have you, and take it away.
Thank you very much, Alan, and thank you to Visante and Beckers for hosting this session. I'm excited to share the journey of Christus Health, but more broadly to discuss the impact that pharmacy services can have, not only clinically, but financially for health systems. So just some background, if those aren't familiar with Christus Health, we are an international health system. We are a Catholic not-for-profit health system. We have operations throughout Latin America, including Mexico, Chile, Colombia. And domestically, we have operations in Texas, New Mexico, Arkansas, and Louisiana. We are a very large health system, clinically integrated, 45,000 plus associates, 15,000 partner physicians. We have over 600 healthcare facilities. When we drill down into the pharmacy department specifically, we have over 700 FTEs. Our drug budget is quite large, as you can see, in over $300 million in expense. And from a doses dispensed perspective, just from Pyxis last year alone, we dispensed over 26 million doses. We have 4 retail pharmacies, and we're continuing to grow that. We're proud of that. And we have 2 specialty pharmacies currently under operation. I'm Dave Benner, and I started as the VP of Clinical Ancillary Services back in 2018, November, in fact, middle of the fiscal year 19. And in addition to my pharmacy responsibilities, I have scope for laboratory, radiology, and a number of other departments, but I was specifically brought in to develop a pharmacy strategy. And at the time when I started, my position was net new. There was not a previous VP of Ancillary Services. So this was an investment that the health system decided to make. And because there was no previous infrastructure, our pharmacy department shared that view. No centralized function existed. We did not have a system-wide formulary. We did not have a system policy process, et cetera. And really, by and large, we weren't contributing to the health system in a meaningful way, in a way that I was used to. In a previous life, I spent 6 to 7 years or so with enterprise responsibility for pharmacy and laboratory services. And so we weren't developing and leading that strategy that I know the organization was capable of. And at the time, we were really viewed as an expensive cost center. My role was to bring that strategy and focus to Christus Health. So in the summer of 2019, just 6 months or so after I started, as you saw on the previous slide, we did have one system director that was the bulk of the department, again, largely a consultative role. We brought on a few additional resources, including directors for ambulatory and inpatient clinical pharmacy. We invested in inpatient operations, clinical business services to really look at our retail and ambulatory footprint, as well as our 340B service line, and also regulatory compliance and medication safety. And as you can see here, we were able to promote many of these folks internally and not backfill them, taking resources from the ministry, hospital-based level that were ready to expand and grow their career. Of course, we did add a few net new positions, but really for a system of our size, really a limited impact in terms of the new net FTEs. So as I mentioned, we did not have a current pharmacy system in place. There was no current infrastructure, which is great from my perspective because it allowed us to build a foundation of success, but it also presented some challenges in that there was just so much opportunity to go after. We wanted to make sure that we weren't boiling the ocean, as they say. So we really focused on 3 pillars of success, and that was clinical excellence, operational, and financial excellence. So with all that being said, a lot of work has occurred over the last 3.5 years that I've been with the organization. As I mentioned, I started midway through fiscal year 19. And from a supply chain savings perspective, we saved about $2 million. not a lot. But you can see in fiscal year 22, we annualize that, we're sitting at 26.2 million. And this isn't incremental year over year. This is every year we're finding 24 and 26 million in savings. With a drug budget of over 300 million, it's really not difficult to find those types of savings. From a 340B perspective, when I started, 41.5 million net impact. So that includes drug savings on the purchasing side, as well as contract pharmacy. We've almost tripled our contract pharmacy number since I've started, and that number is at about 110 annualized in the first 7 months. So again, we've grown that by over $70 million. From a specialty pharmacy, we're on track to do over 1.5 million in revenue. And that ambulatory disease management program that I spoke to saved us about 14.6 million annualized this year. So really proud of the numbers. And these are numbers that are actually hitting the bottom line. These aren't spreadsheet numbers. In fact, Christus Health had its most successful financial year ever in fiscal year 21. And I'd like to think that the strength of the pharmacy department was integral in achieving that number. So Christus, future direction, what are the things we're working on? We're really just trying to expand our ambulatory pharmacist model beyond associates. So that program that I referenced, beginning later this month, we are actually launching this same exact program, but for patients. So we're allowing physicians to refer into this clinic. We'll leverage our own specialty pharmacy for dispensing and take advantage of that 340B benefit. And it also aligns with our quality outcomes that the organization has more broadly with diabetes specifically. So we're excited about that. We're also looking to continue to grow our specialty and retail footprint and integrating it with our various commercial health plans that we offer on the exchange, as well as Medicare Advantage, and looking to, again, become the preferred partner in network. And then probably the most exciting thing for me personally is looking at the feasibility of insourcing our PBM function, our pharmacy benefit management function. A lot of dollars in that space, and I look forward to continuing the journey with my colleagues and continuing to drive success for Christus Health as a whole. So thank you for the time. Alan, I'll pass it back up to you.
Great, thanks, David. There are just a couple of things I'd punctuate in your presentation. One is the innovation around PBM and integration of specialty pharmacy, really important program and a best practice. And the second thing is that once you start in this journey, and I know both you and Tim have experienced this, the first year is the build. You don't see a lot of financial benefit the first year, but you really see that exponentially increase in the out years, and that's an important aspect of the program. I'd point out with both David and Tim that they began their careers as pharmacists, but today their portfolios include a variety of ancillary and clinical services, which allows an integrated approach to both population health as well as clinical service management. And that we would also point out is a best practice. So with that, to continue the story from the multi-care perspective, Tim, floor is yours.
Great. Thanks for that segue, Alan. And I also want to thank Becker's and Visante for sponsoring this presentation. MultiCare is a health system that was founded in Tacoma, Washington in 1882. So we have a long history in our community providing support for our local communities. Within our organization, we have 11 hospitals. These include community hospitals, tertiary care facilities, children's hospital, and behavioral health facilities. We have 33 urgent prompt care locations throughout Washington state, which we're continuing to expand, 5 freestanding emergency departments, very large virtual health platform, and then 2 multi-specialty group practices that service the majority of Washington state. As Alan mentioned, my current role as Senior Vice President for Clinical Services encompasses a large number of clinical support areas throughout the health system, but I did start with MultiCare in 2019 as the Vice President of Pharmacy, and I was charged with developing a system pharmacy structure similar to David. When I came to MultiCare, we had engaged some consultants to evaluate pharmacy performance, and the findings that they produced were we did not have an identified system structure for pharmacy. We had leaders in place, but nothing that spanned the full breadth of the organization. We had underperformance in a number of areas, including our 340B program. We did not have contract pharmacy relationships established. Also, just overall performance, how we tracked it, was not robust. We lacked standardization across the organization from a pharmacy perspective, and that was largely due to the way MultiCare had grown over the years, from 3 local hospitals to a large footprint across Washington state. So that standardization just did not come naturally. There were gaps in operational performance as a result of that, including gaps in how we purchased medications, our retail pharmacy performance, USP compliance, and other areas. We also identified that there was an opportunity for revenue growth in specialty pharmacy. As a result of that, when I first joined Multicare, one of the things that I thought was really critical was identify and create the chief pharmacy role, which we were able to do. And then identify key leaders within functional areas that we needed to put in place to make sure that we could really create a system structure that was highly reliable, but also could produce the results that we could achieve. The vision for Multicare Pharmacy is to be recognized as a world leader in pharmacy practice for quality of care, cost of care, compliance, and practice innovation. And we're well on our journey towards that vision. We have gross patient charges of over 1.4 billion. Our expenses are $300 million and 548 associates that support the great work that we do each day. We have 26 licensed pharmacies, including 11 retail pharmacies and 2 specialty pharmacies. We have 8 hospital-based infusion centers, a very large refill center that services nearly 500 practitioners with 1.5 million refill encounters, 25,000 prior auths, and nearly 300,000 phone calls that they perform each year. As we look at the next 2 years, what we've been able to accomplish is to standardize our clinical practice and create performance metrics so we can actually measure how our pharmacists are doing and then translate that into the value proposition for our independent business units, our hospital leaders, so that they understand adding a pharmacist actually produces value. We've been able to standardize our clinical workflows and our documentation, as well as develop standard competencies for all of our pharmacists. So now we know what our pharmacists are doing, how they're able to do that. And part of that is developing 8 standards that all of our pharmacists are educated to, along with expansion into the future. As you look at the results from 2019, we've had incredible performance. Last year, we had over $18 million in net operating margin, and that was up from $16 million in 2020. So in the midst of the pandemic, we were actually able to show substantial growth, which I think is remarkable and a testament to the work that our teams are doing. And that compares to a $5.7 million loss in 2019. So just incredible performance in that space. Other areas for improved performance and standardization was in USP compliance. We have 15 sterile compounding clean rooms. We were able, over the last 2 years, to upgrade all of our facilities to meet USP 797 and 800 standards. We created a USP program manager to oversee compliance, and they implemented standards for training, certification, and monitoring of all of our clean rooms, standardized documentation, and also our policies across the organization. We've also implemented USP 825 for all of our facilities, and we are starting to do facility inspections for our 503B suppliers to make sure that the medications that are compounded externally are suitable to our standards for use in our facilities. We've also focused our energies on our drug diversion program, implementing a systems-wide diversion monitoring technology that we've used to identify potential diversion events. We've created a diversion prevention team, including a program manager and 3 diversion prevention analysts. We've implemented system-wide standard processes for our auditing, our documentation, how we investigate events, and also how we report those events to our regulators, as well as standard policies and procedures across the organization. 340B has been a big opportunity for the organization. We have 7 covered entities that we currently support. We were able to implement a system-wide 340B program that includes a program manager, a director, and 4 analysts. I think one of the things that I want to highlight with 340B is there's opportunities within the space, but it's also incumbent that you invest the resources to make sure that you're operating a fully compliant program. And part of that is just how we implemented our contract pharmacy. We've been able to expand in that space where we did not have that before. We've also implemented our standard auditing processes across the organization, as well as training and certification for our analysts and those that work within the 340B space. And as a result of those efforts, we've been able to double that program from 2019 in terms of performance. Pharmacist supply chain is another opportunity that we were able to improve. We implemented a centralized pharmacy purchasing program with centralized order review and educated all of our purchasers on standard processes to support that. We were able to renegotiate our wholesaler agreement to achieve greater value. We've also focused our energies on identifying where we can improve our spend, minimizing our WAC spend, and maximizing our 340B, as well as our contract compliance. And we've implemented technologies to help identify those opportunities. As a result, this last year, we were able to achieve over $7 million in new savings. These are just some of the key metrics that we've been tracking to show our performance improvements over the years. And you can see that investment in pharmacy is a value add for the organization. And really, pharmacy has gone from being a cost center in a lot of organizations to a strategic asset, which is where we want to position it for multi-care. Some of the key areas that we're focusing on as we move into the future are PBM development. We want to make sure that we have recently engaged with another partner in terms of creating our own PBM, and we plan to deploy that with other customers as we move into the future. We also want to continue to expand our specialty pharmacy and our retail pharmacy platform. As contract pharmacy changes, we want to have a platform that we can further realize value from, as well as using those specialty pharmacy platforms for our own employees and how we can leverage that to reduce the plan costs. We want to continue to invest in our people and make sure that they have the skills, the knowledge, and the training to do the best and operate at the top of their license. That includes expanding our PGY1 and PGY2 programs. We also are creating alternate site infusions as site of care issues become a major challenge for organizations where hospital-based billing is no longer permitted. Creating a centralized service center, and also using our data to the most so that we can achieve value in areas that maybe we haven't identified. So consolidating our data, making sure that we're able to dive into that and use that to improve performance. And I'll turn it over to Alan.
Great. Thanks, Tim. I really appreciate your focus on building a comprehensive pharmacy structure, which has been pivotal to achieving the results you've achieved. So again, another best practice here to punctuate. Phil Brummond, national perspective on where you see pharmacy transformation moving.
Thank you, Alan. Really appreciate the comments from Dave and Tim as far as their journeys over the past few years as they've invested heavily and their organizations have invested heavily in pharmacy as a system-wide initiative to drive value, not only to the bottom line, but to the patients that are served each and every day. So I'd like to provide some perspective as Visante has worked over the last year or so, 200 plus hospitals and health systems. And what we have seen as organizations similar to Multicare and Christus, when they're investing in a pharmacy system approach connected to strategy of the organization, there's an opportunity for $20 to $30 million in annual value, whether it be through enhanced revenue or cost savings. And when we look at the investments that have been made and look at the journey over the last 25 years or so, pharmacy has definitely become much more complex and sophisticated. And when it comes to the evolving structures within hospitals and health systems, that too is ever evolving. And so when you look at medium to large size organizations that have hundreds of $millions in drug budgets and management of that, large clinical programs, site of care management and ambulatory acute care, a variety of other areas where pharmacy and clinical pharmacy services are occurring. It's important that the investments are made, and pharmacy is positioned as a strategic asset in the organization, helping establish and set strategy as it pertains to pharmacy, and then being able to leverage that strategy to help drive overall performance of the health system. Some of the most recent things we've been seeing over the last couple of years is organizations looking to pull out some aspects of their pharmacy enterprise into structured LLC organizations that allow them to work and be more nimble, especially in the for-profit headwinds and environments that are out there today. And doing so also allows the health system to utilize pharmacy essentially as a front door for patients with employers and others in their regional markets. And as both Tim and Dave alluded to, the senior pharmacy executive at these organizations are looking to diversify ways to enhance revenues in the organization, and being able to form that strategy, articulate it, and being able to make sure that it's put on both multi-year and annual plans really allows the organization to achieve the benefits of improved quality, safety, and overall financial performance. So as COVID turned us all upside down within health systems, a lot of things have been happening in the marketplace that has created headwinds, not only for the organizations, but also for the pharmacy departments. And I'd like to highlight just three of what I see as some of the key things that over the next couple of years, health systems and pharmacy departments are going to need to continue to not only focus on, but having that system-wide strategy and approach will really allow organizations to leverage the talent, expertise, and drive strategy to address and mitigate some of these challenges that are in front of us. The first is around site of care. Over the last several years, payers, PBMs, and pharmacies have been vertically integrating in the market. And as things shifted in COVID and many health systems were focused on making sure that we were caring for COVID patients, some of the dynamics in the external market evolved and payer mandates started becoming more widespread. It started obviously in pockets and regions. And so if you're in a region that maybe isn't experiencing some of this today, you can be certain that likely this will be on the radar and need to have a strategy and plan to address it. At first is around white bagging. And so from a payer mandated perspective, for specialty products that traditionally would be buy and bill within your facilities, the PBM and or the plan is pushing those to one of their own retail or specialty pharmacies and then shipping that back to the hospital where the pharmacy department or the clinicians in the clinic are asked to prepare this and then try to administer that to patients. And obviously that process is extremely complex and at the same time has significant impact on safety, quality, overall patient care, as well as financial hardship when it comes to organizational financial health. We're seeing quite a bit of shift in the payer market as it pertains to home infusion, freestanding infusion, non-hospital-based infusion environments. Important that strategy is laid out and also an important aspect when it comes to meeting patient expectations. We saw a lot more of this, especially during the last couple of years as we've been working with COVID. From a business disruption perspective, as highlighted earlier by both Tim and Dave, 340B drug program is an important aspect of being able to provide services for many hospitals and health systems in the country. It's important you've got programs in place and established to be able to not only make sure that that program is compliant, but ways to optimize the program to make sure you're getting as much value out of it as you possibly can. Manufacturers over the last several months continue to put challenges in front of pharmacy leaders as it pertains to contract pharmacy and restriction of networks and wanting pharmacies and health systems to share data. The COVID-19 pandemic created supply chain issues across the whole market. From a pharmacy perspective, they've been particularly challenging as it pertains to shortages and those pieces. We've seen many organizations who have taken a system approach to pharmacy being able to mitigate those challenges and leverage the expertise and use the system from not only the buying power perspective, but being able to maneuver drug throughout the system in a way that saves money and at the same time allows for patient care in the challenging environment. And from a workforce perspective, that's a big challenge for hospitals and health systems, nursing, variety of other radiology techs, lab techs, physicians in some areas of the country. From a pharmacy perspective, this is also front and center. And when we look at optimizing pharmacy's value through a system approach, and as both Tim and Dave alluded to, investments in this space lead to better quality, service, financial performance, and improved efficiency. And that really starts with making sure that you've got the right entrepreneurial pharmacy executive that's tied in with the rest of the organizational senior leaders, making sure that from a pharmacy perspective, the plans that need to be put in place are landing appropriately on the strategic plan of the organization, the annual plan, so that interdepartmental collaboration can occur. And some of the areas that we are seeing today are highlighted here on the right of the slide. And the first is around benefits management. And as both Dave and Tim alluded to, how do you work closely from a pharmacy perspective with the benefits committee, HR and others to help make sure that the money being spent on medications, you're getting the best value out of that and being able to make sure patients have access to the products that they need at the lowest price point and helping save their organization, not only money, but also helping improve clinical outcomes for the patients that are and employees as part of that health plan. We're seeing investments around consolidated services and looking at ways to invest in resources and bringing resources together that allow for formulary management, supply chain initiatives, being able to prepare using 503A or other avenues to distribute medications to other hospitals and clinics in the network, and really using that as a launch pad to get into some of the site of care challenges in home infusion. The last thing I'd like to highlight as we look at expansion of services, more and more sophisticated, and organizations that have done similar things like Dave and Tim have done within their organizations. We're seeing expansions of services into the community and looking at becoming a trusted partner for being able to solve some of the employer challenges when it comes to management of specialty products, access to services, clinical services, and overall management of pharmacy benefits for them. And investing in pharmacy really gives that that opportunity to use pharmacy again as the front door for the health system, where patients may decide through use of pharmacy to then bring them into the primary care and other aspects of the health system. The right level of executive support and sponsorship by an organization with the right strategy and an entrepreneurial pharmacy leadership team really blazes the way for a bright future when it comes to solving some of the biggest challenges and opportunities that lie in front as pertains to pharmacy services. I think I'm going to pass it over to Steve now.
Thank you, David. Thank you, Tim and Phil, for your great presentations. My name is Steve Rao, and I'm a Senior Vice President with Visante. Before that, I had a 20-year career as a health system pharmacy executive. I'm going to start off facilitating our question and answer sessions. We're going to make sure we keep it under the 60-minute window here, but I will start off by asking our panelists a question while we wait for audience questions to roll in, and then turn it over to Mackenzie to help facilitate any audience questions that we get. So my first question for David and Tim. You both shared many great results, great financial results, as well as stories about improving quality and service related to pharmacy transformation in your organizations. And my question is, what do you each think have been the one or two most critical factors in assuring your success in that journey? And maybe we could start with David first.
Thanks, Steve. I would say just the leadership commitment at the C-suite level. As I mentioned during my presentation, my position was net new, did not exist previously. And so I think the foresight that our CEO had, but then also to follow it up with the support of hiring an entire staff. And so Alan made a great point that the benefit tends to lag as you have that ramp up. So you're investing a lot of resources initially with the promise of return. And so when I originally had asked for, I believe it was 5 or 6 FTEs net new, there was no hesitation from our C-suite to approve those positions and to trust and invest in the process. And so I've had that buy-in, not only in my pharmacy space, but other departments that I lead. And so that continual commitment has been extremely successful.
Thanks, David. And Tim, what about multi-care?
I think, Steve, you talked about some of the financial highlights that both of us have been able to talk about. That really, to me, is a lagging indicator for the work that really needs to happen, which is focusing on clinical quality, your operational excellence, and then just having a very solid leadership structure. And I think the keys to achieving that are really by the recognition of the organization that pharmacy can be a strategic asset, not a cost center. And so investment in pharmacy services can really result in transformational impact for an organization. And at a time where organizations are suffering from tremendous fiscal challenges, pharmacy is one of those bright spots that can do amazing work in terms of supporting bottom line performance, but also moving us to the future where population health is where most organizations will live in the future. And pharmacy is well positioned to do that. So I think that recognition by the organization that it is a strategic asset, and like all assets, you want to invest in that, but really providing the people, the tools, the resources, and the flexibility and space for those pharmacy leaders to really be entrepreneurial, think outside the box, try things new is really key in terms of creating success.
Yeah, I think the thread I heard in both of your answers were the trust and the relationship that the pharmacy executive has with the senior leaders of the organization, and then senior leadership support for investing in perhaps a structure at the system level that maybe hasn't been in place before, but is essential for local level success. So thanks both for sharing those examples. And I think we might have an audience question or two that has come in. So I'll turn it over to Mackenzie and ask her to ask that question.
Yeah, thank you so much, Steve. We have had a lot of great questions come in. This one is from an audience member who is asking, what 1 or 2 pharmacy-related issues keep you up at night, and what's your mitigation strategy?
As I'm thinking about that question, I think there's a few things that really jump out for me. One of those is 340B, I think, is under attack right now. As manufacturers have changed how they support replenishment for contract pharmacies, that's having a huge impact on 340B performance. And so I think looking for ways to mitigate the impact of that, whether it's building out your retail pharmacy platform, your specialty pharmacy platform, so that you can insource as much as you can for those prescriptions, is one thing that we're looking at in terms of mitigation strategies as a result of that. I think another thing too is I think we have to be thinking about the market disruption from some of the new entrances into the marketplace. We've got Mark Cuban, we've got Amazon, we've got other players in the retail pharmacy space that are going to create different pressures for us that I think we need to be thinking about. How can we continue to innovate as a health system? And we're in the fortunate position that we've got patients who have already opted in to be part of our health system. So let's try to focus on that continuum of care and innovate how we deliver that care in a new way, really to shore up our performance in that. I'll turn it over to David.
Yeah, thanks, Tim. I completely agree. And in an effort to not reproduce your answer, I was going to say the 340B manufacturers pricing for drugs is something that kind of keeps me up at night. And I think one of the other broader things that I think about, it doesn't necessarily keep me up and it's not a concern, but I'm continually thinking about how do we keep things purple? And that's a reference that we use at Christus, purple being our color. We have so much opportunity for revenue. We have so much opportunity for enhancing the coordination of care, but all of these services leak out to outside entities, the disruptors that you just referenced, Tim, to competitors, to various companies. And so we have these patients in our doorstep. We built the trust. They have the patient-physician relationship. And so they're entrusting Christus Health to their care for themselves and their family. And so how do we leverage that and find unique, creative, user-friendly ways to access our services that we already own, like our retail pharmacies, like our specialty pharmacies, like our integrated lab offerings, our imaging centers. And so that's something that I'm continually thinking about and focusing on. And how do I connect stakeholders within the organization to produce kind of that full continuum of care and not allow that leakage to competitors? And so I would say that's kind of really what my focus is now and will be into the future.
Well, thank you, David. I'm always going to remember that comment, always keep things purple. And I'll add on behalf of Tim, blue, how to keep things purple and blue, which is the multi-care color. Whether you are a disciplined hospital collaborative trying to do things in more common ways, or whether you're an integrated health system, I hope you found some nuggets of information that will help you continue the journey of transformation in pharmacy. There is a huge opportunity in pharmacy, and we wish you well all in pursuing that.